COVID-19 Antigen Rapid Test Self-Testing Test Procedure. Open the kit box. Check the components before use. Read the construction carefully. Insert the tube into the hole. Unscrew the lid of the extraction reagent. Add all of the extraction reagent into the tube. Open swab package at stick end. Take swab out. Gently insert the entire swab tip about 2.5 centimeters 1 inch into left nostril. Firmly brush against the insides of nostril in a circular motion 5 times or more. Remove swab and insert it into right nostril. Insert the nasal swab into the tube which contains extraction reagent. Rotate swab at least 5 times while pressing swab tip against the bottom and side of tube. Leave swab in the extraction reagent for 1 minute. Remove swab while squeezing the sides of tube to release the liquid from swab. Cover the tube with the provided cap tightly and insert the tube into box back. Open the sealed pouch and take out the test cassette. Hold tube vertically over sample well, not at an angle. Add 3 drops into sample well by gently squeezing the sides of tube. Read test result at 15 to 20 minutes. Do not read more than 20 minutes. Interpretation of results. Positive result. 2 lines appear. 1 color line appears at the central region C, and another appears at the test region T. Note: please look very closely. The T line can be very faint. Any color line visible here is positive. A positive test result indicates that you are very likely currently have COVID-19 disease. What do you need to do? Consult your healthcare provider or local health department as soon as possible, and follow local guidelines for self-isolation to avoid spreading the virus to others. A new test with other test methods, such as molecular testing, may be required. Negative result. 1 color line appears at the control region C, and no line appears at the test region T. A negative test result indicates that you are unlikely to currently have COVID-19 disease. What do you need to do? Please consult your healthcare provider if you develop symptoms or symptoms are persisting, or if you are concerned about your health. You must continue to comply with all applicable rules regarding contact with others and protective measures. Invalid result. Control C line fails to appear. Note: if C line does not appear, the test result is invalid regardless of the appearance of whether the T line appears or not. You need to retest with a new test cassette or consult your healthcare provider. Collect parts of the kit and swab specimens in a plastic bag and dispose of them with household waste.